Great. We're going to go ahead and get started. I'm going to keep an eye on our waiting room and hopefully admit a few more people as they join us. I am Kathy Borders. I'm happy that you are with us today. This is the Butler County Board of DD's January provider meeting. I hope that your new year is off to a good start. I'm glad that you decided to join us this morning. So to get started, I just wanted to share with you our agenda for today's meeting. Also want to just mention that we will have time for questions throughout the meeting today. So feel free anytime that you do have a question relevant to what we're talking about, feel free to unmute and ask that. You can also enter questions into the chat. However, I may not be able to get to all those questions today during our meeting. If for some reason I am not able to get to your questions, I will follow up with you. But we are going to do our best today to try and get any questions that are entered. If I don't see your question and it's something that the whole group could benefit from, feel free to unmute and ask at that time. That would be very helpful. All right, so our agenda today is we are going to get an update from our superintendent. Leanne Emmons will be here today to give us just an update on our county board. I will be giving provider updates as usual and training opportunities. And then we are also lucky enough to have Robin Thomas. She is a support coordination manager at the SWOCOG. She is going to be with us today to give us some compliance updates. So I'm going to go ahead and get started, I believe, with our updates. I'm just checking our room here to see if our guests are here or not, trying to decide which direction we're going to go with our agenda. Okay, I'm going to go ahead and start with our updates today. First, we had some information from our community connections team who weren't able to be here, but asked me to share this with you. So our next Cookies and Connections parent network meeting is coming up in March, but registration has now opened for that. So we encourage those of you that are parents to consider joining. They are going to provide helpful resources. Children of all ages are welcome to attend that. And that is from 6 to 8 in person at the Janet Clemens Center. And there's the registration link. All right, provider related. Leanne will be sharing some of these updates as well. But just want to provide a few things that are more specific to provider world. So as you know, or most of you know, Amy Winkler is kind of retired from the board for right now. And so I am here a solo in provider relations. So I'm here for support. So if you need support or have questions, please reach out to me. There's my email and my phone number. If you do call, I encourage you to leave a message, as we will maybe not always be able to return calls that are not with a message left. So if you do try to reach Amy, it'll just bounce back or let you know to reach me instead. But there's my email for you. And then also a change is that we are no longer this year offering background checks and CPR and first aid training at our office. We do have an alternate vendor list that we have created for you to be able to find both of those needs in our community nearby, and we will share that out with you today in our meeting minutes. Another change, and this was in effect of January 1st, so you may already be aware of this, but our building in Hamilton is closed on Fridays. Staff are working, they're just doing so remotely. And then our building hours shifted just a little bit on Monday through Thursday. We now open at 8:30 and open till 4. Just wanted to make you aware of that. Going into some updates compliance-wise. So DODD recently published overtime guidance for independent providers. Some of the takeaways from that guidance is that hours must be approved by the individual's SSA and included in the service plan before they are worked and billed. So you want to be in communication with the SSA before you are working any hours, but of course, any overtime that needs to be communicated and agreed upon and worked out. The guidance says that teams are asked to work collaboratively to efficiently use available resources and to the extent possible, reduce the need for overtime. So if you have any questions about that, I would encourage you to reach out to your SSA for that team discussion to occur. If there is a need for emergency coverage, that needs to be reported to the SSA within 72 hours of those services. I have linked the full guidance that was issued for you here. Feel free to reach out though if you have questions about that as well. So it is time for our annual MUI annual analysis. Those of you that are independent providers will be happy to know that with the rule change, the MUI rule change that occurred last year, independent providers are no longer required to complete the annual MUI analysis. So you do not need to fill that out. You do not need to submit it. No longer. It is still required for agency providers. It's required to complete it and also to submit it to the county board, each county board that you provide services in during the 2025 year. And you need to submit that to the county boards by February of 2026. I did want to mention for independent providers, because I know this can be a little confusing, you will still want to continue your monthly UI log, even though you're not completing an annual MUI report. You do need to continue, and this is for agency providers too, actually. You do need to continue to do that monthly UI log. Even when there's no incidents, you're completing that every single month. That has not went away. The county board just will no longer be requesting that from you, but you will maintain that with all of your other documentation. I have linked the new MUI toolkit resources for you here. There is an updated MUI annual analysis form that has been posted there just last week for agency providers. And we will be sending that out today in our meeting minutes as well. Any questions for me so far? Perfect. All right. So just want to touch on EVV. In our county, it feels like EVV is going really well. We continue to be very pleased with how things are going. I don't know for sure if you all feel that way, but on our end, what we're seeing is really great. And so just want to remind you, you can make corrections to your EVV submissions. If you forgot to log a visit, you forgot to clock out, that happens so often. That is completely fixable. And so there are a couple different guides and links here that you can use to make those adjustments if needed. Feel free to reach out to us. Sandata is also a great resource. We can help on higher level things. If it's more technical, Sandata will be your best resource for those kinds of corrections. So overall, great job with EVV. Does anyone have any questions or things they're seeing lately with EVV they want to share? Okay, great. I'll take the silence as a good sign that things are going so well for all of you. A reminder again that it is outcome tracking reporting time for those of you that provide adult day and employment services. That reporting period began on 10/1. You have 6 months to get that completed. So it's going to be due March 31st, which will be here before we know it. So begin working on that if you haven't already. They are collecting data for the individuals that you served in September of 2025. And there are lots of great resources and helps available for you in completing that reporting if needed. Get linked here. Wanted to share with you that the DoDD, DSP, and provider support team is hosting an information session next week, January 26th from 10 to 11. They are going to be sharing a lot of great resources that are on the DoDD website. and also show you their new DSP and provider toolkit, which I have linked here. It's on Padlet. It's really great. It's a site that has all kinds of resources all in one place that are provider related. So it's a really great resource for you. So they're going to be going over that to kind of share with you what is all there. So I encourage you to sign up for that if you're able to attend. I have the link here for you as well. Remote support services, service providers. Just wanted to let you know that there was a update to the remote service rule. And that update says that as of January 1, all remote support staff must have a background check completed. And so those of you providers that are impacted by this change, you have until February 11th to initiate that background check for all current remote support staff. And you need to make sure everything is completed with that process by April 1st. So just want to make you aware of that. In the chat, just want to point out that Ann Tapia is here from DODD. Glad you're here. And she is a great resource for you. Those of you that are doing the outcome tracking reporting, she is a great resource for you. She has put her email address in the chat. I'll also include it in our meeting minutes for you as well. But she is available if you have questions with that process. We will be sending out the PowerPoint today. So in the afternoon, I will be sending out minutes from this meeting, and as also any handouts or resources that I reference will also be linked there. And I will drop the link for the toolkit. Can you clarify, Launchpad, about the link sent in the chat, which one you're referring to? If you can just provide a little more data there, I will get to that. Independent providers need a background check. I'm just reading some questions from the chat for us right now. So you got a background check when you were certified. At the time that you were certified, you enrolled in something called RAP Back. And that RAP Back means that DODD is pulling your background all the time. You no longer have to get a background check unless you have lived outside of Ohio in the past 5 years. When you come time to recertify, which is every 3 years, if you indicate that you've lived outside of Ohio in the past 5 years, you will be required to submit an FBI check. Otherwise, you do not have to do a background check again. Remote supports is for agencies, so that information was about that. All right, feel free to drop more questions in if I missed anything, or if does anyone have anything they want to ask? All right, so I mentioned this last time we met, but we are in the process of updating our adult day array directory. We're really excited about it. It's going to be an awesome resource. It's going to be posted on our website, shared out with our families and SSAs. It's a really great opportunity for you to do some marketing. You get to highlight your services, your website, your logo if you want. So we are in the middle of getting that together now. So we just have another week or two. If you haven't already submitted the information you would like to have included in that directory about your program, this is your last chance to get that submitted. I will have the link in the meeting minutes, or you can scan this QR code to get that done. If you've already submitted it to us, you don't need to do it again. We have it. We're building that now. If you don't submit it, we are just doing a short overview based on the information we do have. So you won't be left out. You just won't have maybe as much information as some of the other providers do. All right. There was another question in the chat. So I'm just going to go to that first here. If we are an agency, is there a different procedure for background checks? So as far as the background checks, when you recertify, if there is a new DOO, a DOO has to complete a background check. I do not believe that. I think that once you do that, I'm going to look into that and get back to you. Actually, I'm going to write down your name. I do not believe that you have to submit it every time, just if there's a change of a DOO, because that is the only background check that is being submitted for the agency. As your staff are being hired, you are responsible for getting background checks and maintaining those, doing all the checks that are required. But as far as what you submit to DODD for background checks, that is just for the DOO. And so I believe at recertification time, you're not doing that again. I will get back with you if that is not correct. So very timely, but there is a training being offered for agency providers. The DoD MUI office is hosting a webinar to help agency providers in filling out their annual MUI report, and then using the OITMS application, how you can use that to find the data that you need for your provider reports. So that is coming up next week, January 26th, 1 to 2. It should be a great resource for you as you're completing that annual report. Another training opportunity, the governor's Ohio Governor's Office is hosting a Ohio Human Trafficking Awareness webinar. It's with the Human Trafficking Task Force. They are going to be sharing real facts from our state and also from the country, examples of things that are happening here and what to do if you think someone is a victim. Sounds really interesting. That is January 27th, and you can register with this link that you'll have in your minutes. The Ohio Healthcare Advisory Committee is hosting their spring conference. They host these twice a year. Really great for nursing, those of you that need nursing hours. That is in Columbus, in person, all day. The featured speakers this time around will address safety and dignity of a risk. That is April 15th. There is a $75 registration fee, and we do not yet have registration for that open. We will get that shared out once we have that. OACB is hosting a special SSI and Social Security Disability Basics training as part of their Fear Factor series. It's a great chance to learn about those benefits, things that impact their individual's level of benefit coverage when they're working. And that's so great opportunity to help people with lived experience. That is January 26th from 1 to 2, and registration is open. There are CE hours available if you want those. When you register, you'll indicate that. Here at Butler, we are continuing our in-person office hours that we host each month. We are hosting them just once a month in 2026. We have our dates here. We also have a flyer we will share out. It's at the bottom of all of our communications as well. We start with a short documentation training, so that's helpful for those of you that are just getting started. And then also if you're preparing for a compliance review, it's also a great refresher for that to make sure that you have everything correct. As you know, there are things that change all the time with requirements, so it's a great refresher for that. We ask that you bring your documentation and plans with you to help it be more interactive and hands-on. You do not need to register, just you can just come whenever you're available. Wanted to share with you the dates for our provider meetings for the remainder of the year. Our next one is March 18th. These will all be on Zoom. And that is all of my updates. I'll pause and see if there are any questions for us. Okay. All right, someone is asking if I can put up the QR code for the day program. So I'm just going to go backwards. Hopefully it doesn't make you dizzy. There is our QR code for our adult day directory. Got that up for you. Any other questions or anything before we move on? Okay, perfect. All right, well, I do not believe, unless I am missing her, I do not see our superintendent, Leanne. If you are here, feel free to unmute. She will have updates for us. And if she is not quite here yet, we are going to switch to our other guest who is with us today as soon as I can stop screen sharing here. Oh, actually, our superintendent has just arrived. Perfect timing, Leanne. We just went through our updates. I was just getting ready to introduce you. So I'd love to turn the time over to you, Leanne, if you're here.
I am
For your
sorry
update.
I'm late. I had another meeting that ran long. So sorry, guys. Hi, everyone. Looking across to see who all's here. A lot of people I recognize. I'm here to just give an update on what's happening with the board, our finances, and our levy. I think I was here in the fall to give an update then. As of yesterday, we are officially going to be on the ballot on May 5th of this year. Hopefully we will have our issue number soon, but we are going back to the voters. We were approved by the commissioners for our last approval yesterday. We are asking for 2 mills continuous, which a lot of people don't know what that means. So I'll just break that down in numbers that people understand. For $100,000 home, it's about $70 a year, about $5.83 a month for $100,000 home. So you have a $300,000 home, 3 cups of Starbucks, 3 Starbucks drinks a month is what I've been equating it to. That's what I'm gonna have to give up if I want to pay for this. So that official campaign is actually starting now. After I finish talking, I'm going to share in the chat a couple of things that Kathy can also put out in the minutes from this. We have an official levy website if you would like to go there and sign up to be a part of the political action committee. So just to give a little background there, we do not use and cannot use county board resources, so funds or staff, in order to run a political campaign. So we have a political action committee that is our fundraising arm and also organizes our campaign. We have a political consultant or a campaign consultant who is helping us run our campaign, but we are always looking for volunteers to do various components of that. So whether that would be going out on speaking engagements with people from the board or from the PAC to speak to groups and public officials about the importance of our services and our levy, or as simple as working the polls on election day or putting a sign in your yard or in your business. Again, we can't do that on work time. I'm allowed to talk about it during this because I'm staying factual. I can't say please vote for us, but I can talk about the facts of the levy. A couple of things that I think it's important for people to know. If you haven't seen our fiscal emergency document, we'll also include that. Kathy will include that in our minutes. 80% of the board's funding comes from local property taxes, and we have not been on the ballot in 22 years. So you can imagine we are definitely running out of funding. And with the recent rate increases, which were so important to the field, we have seen that need to go back on the ballot amp up really quickly. So we are currently, our waiver match, which is our biggest line item, our obligation is currently 97% of our collections. And our waivers, 40% of our waiver is paid for with local funds. So all of those waiver services that you providers are providing, they are matched with local funds. So it is crucial that we get an update in that funding. Some of the things that are happening, if you provide day employment, transportation, I think that's it, locally. So that's locally funded only. If you have a contract with us, not waivers, we've already had a conversation with you about how we're cutting some of our local funds. We have got to make massive cuts in our services that we have control over to be able to make that waiver match. So for those of you that aren't aware, our fiscal emergency document outlines some of the things we've done so far. Our staff have all taken about a 7% pay cut. We're closed on Fridays. The building's closed. We're still open for work, but we don't have our building services on Fridays. You've probably seen that we had to stop providing CPR and first aid and background checks for providers. These are all things that are funded with 100% tax dollars. And so we are really just trying to preserve those services. When we pass in May, because I'm going to stay positive, we actually won't collect on those new dollars until about the end of the first quarter of 2027. So since we're operating in a deficit, our cost saving measures are going to go all the way through this year, even if we pass and into the first quarter of 2027 at a minimum. We're also working with the state, with the provider entities, and also DODD around system reform and figuring out ways that we can sustain the system long term, because I'm sure all of you are aware and probably feel it as well that property taxes are increasingly becoming a hot button issue, and it's going to be a challenge for us to pass. We're going to need all of our partners explaining the importance of these services, providing good services in the community, and partnering with us about why this is important that we have updated funding. One other thing I'd like to mention, we are having a special meeting for providers from the PAC. It will be PAC sponsored. It will be on February 4th at 10 a.m. virtual. I will include the link for that meeting as well. We would love to have as many of our providers as possible on that call to help us strategize about what providers can do, because you have a really unique opportunity to really connect with families and other businesses. And from a business perspective, it's important to share why the services we provide are important. So we definitely need your assistance, and I would love to see as many of you as possible at that meeting. We also will have a PAC kickoff event. So our first official public event for the levy will be on Monday, February 9th from 4 to 6 at Pullman Lanes in Hamilton. There'll be food and drinks and an opportunity to sign up for various committees and commitments, yard signs, working the polls, speaking engagements. So both of those are great opportunities to get involved. And it's going to take a village to get this done. And we consider our partnership with our providers one of the most important ones. So I'm just here to give you those updates. Happy to answer any questions anybody has. I don't know. I see some stuff in the chat, but I don't think it's questions for me. Anybody have any questions that I can answer? No questions. I don't know if that means I did a good job or you don't even know what to ask. Either way, you can email me. People know how to get me. I'm going to put all the links to all the things I talked about. Oh, I see a couple questions. The event on the 9th is from 4 to 6. We will put the link. I'm going to put the link to the Zoom meeting on the 4th. I'm going to put the link to our PAC's webpage that has a Google form you can fill out if you'd like to get involved. And then we will also make sure we send out the financial fiscal emergency information so you can share that if you have questions as well. Thanks for your time.
All right, there's no other questions. Thank you so much, Leanne. All right, so next we're going to hear from Robin Thomas, who is on the call with us from the SWOCOG. I will turn the time over to her for our compliance updates.
Thank you, Kathy. Hope my voice holds out. Just got over the flu, even though I had a flu shot. So we'll see how it goes. All right, I need to share my screen. Bear with me 1 second.
That's always the worst part about
It is.
Getting that shared screen to work.
Everybody's waiting on me and I'm trying to get things going here. Okay, let's just find the right one. And that's not the right one.
Yep, we can see your notes and everything right now.
I know, that's not the
And
right
someone in
one.
the chat did ask about the time of the call on the 4th. while she's getting that up. We know that.
Sorry, I had to get back to my screen. Yes, it's at 10 a.m. And I'm loading up those links now.
Perfect, thank you. They're beautiful, Robin. It looks great.
Okay, I have the right one now. I'll blame it on the flu. So, all right. Okay. So here's the things I'm going to be going over today. The reasons for the tool updates, the review of what updates have gone in place, a little bit of information about EVV since there is a tool question that went into effect this time around, and how we are checking that, and then what the most common citations are right now. So I will jump in with the reasons for the tool updates. Now, these tool updates went into effect in November, so we're a few months behind, but hopefully you guys got a little bit of info on that, but I'm going to go into some more detail on what those changes are. The reasons for the changes are there were some changes with things with medication rules and some updates around family delegation, which is now called family authorization. A little bit of changes with nursing rules. There's some other ones coming up on that, but just to kind of clarify some things with that, there was the new vehicle modification rule that went into effect, updates with the MUI rule and those changes, just some overall language adjustments, and then the addition of a new question for DSP assistance. I did not separate all of these out for agency, independent, and ICF. So these are just kind of some general overall changes that are mostly going to apply to everyone. There were no changes in anything to do with transportation, physical environment, remote support, assistive technology, or behavior support this time around. There are, let's see, I need to see some notes here. There will be, with remote support, assistive technology, support brokerage. I think that was all. I'm trying to remember off the top of my head. Most likely, with the changes in the spring, which are generally in April, with the changes in those rules, there will most likely be some updates at that time around those services. Let's see, where are you? There we go. So I'm going to jump in with what the changes are. There are lots of updates with language. And so with some of the things in the service planning, with nursing quality assurance reviews, they're now called nursing quality assessment reviews. And then the question about revisions to service plans. Previously, it said that revisions should occur within 30 calendar days. Now it says revisions to occur within 30 calendar days of a request or identified need. So if you have requested that an SSA do a revision to a plan, you should see that revision definitely occurring within 30 calendar days of that request. It was supposed to have happened that way before, but now the language is very clear that it needs to happen within 30 calendar days. There is additional guidance under the time delivered services started and stopped, mainly with waiver nursing. And it talks about a nursing visit cannot exceed 16 hours. So they're supposed to be 12 hours during a 24-hour period, except if there are unforeseen circumstances. But then they should not exceed that 16 hours. And that's in the guidance for services, delivered services starting and stopping that question. For another waiver nursing question, it talks about the individual's plan of care, their 485. They took out all of the extra information in the question and basically moved a lot of it to the guidance. So the question itself only says, for the individual's plan of care, does it include everything that's required in the rule? And then moved a lot of those things to the guidance. So they just kind of rearranged how that question is done. So then for MUI, there are several different things because of the changes with the rule. The incident report is now required to have the time of the incident. Unusual incident logs, they just changed dental injuries to dental injury that does not require treatment by a dentist. And then an unplanned hospital admission or hospital stay, that's not a major unusual incident. So making sure that the log contains those types of things. And then this has never been in the actual rule before. It was always kind of what we were given as guidance and direction, but that for the unusual incident log monthly review, and Kathy already referred to this, but when no unusual incidents occur during a calendar month, you need to make sure you have a notification to that effect on your log. No incidents this month, or just no incidents, something on the log to show that you're aware that you're required to keep an unusual incident log and that you indicate that no incidents occurred that month. And then for identification of an MUI, this is about immediate actions. They changed other necessary measures to protect someone's health and welfare to reasonable measures to protect health and welfare. And then for the guidance, they changed that to say that the provider is responsible for notifying the county board when the employee returns to work. That's the only guidance that's in there, that the provider is responsible for notifying the county board when the employee returns to work, not if there's changes in protective actions, like returning the employee to duty, changes supervision levels, things like that. It's just basically when the employees return to work. They updated the definitions for the MUIs requiring the 4-hour notification. Of course, the change in accidental and suspicious death, they changed that terminology to unexplained or unanticipated death, and then changing verbal abuse to emotional abuse. Guidance on submission of incident reports to the county board. So notification when you're sending information to the county board, it should be by a means that the county board has identified. So if the county board has a particular email address they want things sent to, If they have, some other system that they use, it should be that you as providers have sent an incident report to the county based on how the county wants to receive those. And then notification of MUIs. This is an addition to that list of notifications that once an incident has occurred, where you have to notify the guardian and the SSA and law enforcement if it's something that requires law enforcement. Children's services if it's someone under the age of 21. You have to notify your agency director of operations or a licensed facility administrator within 1 working day following becoming aware of an MUI that involves misappropriation, neglect, physical or sexual abuse. So you should have another line for notification to that particular person on your list of notifications on your incident report. And then there is the question about with the change in how notifications to law enforcement incidents involving law enforcement, unanticipated hospitalizations, and unapproved behavior support. Those appendix forms that you complete. There's a question about if those forms were completed and sent to the county. So that question is there. Also, if you are looking at the compliance tool, there is a link to where you can get those forms right in the tool. So where that says forms located here, if you're looking at the actual tool on the website or download copy, that link should be active to where you can get the forms. All right. Then in personnel, there's a question. The first question in personnel is if the director of operations is listed in PSM. And then the only thing that they added is in the guidance about that's not applicable for licensed residential facilities, because there's a new question further on about licensed residential facilities. And I'll go over that in just a minute. Now, this next bullet, where they have a lot of questions about DSPs, they've changed the terminology in the tool in a lot of places to employees in direct service positions, because maybe you have someone who only does transportation and they have to have background checks. They have to have certain types of training, but they may not necessarily be called a DSP. They may be just a transportation service provider. So they changed that terminology in some of those questions to encompass anyone that actually does any type of direct service. So it includes anyone who does any type of job that involves direct service. And that might be a nurse who does direct service, someone who does waiver nursing, someone who, like I said, does transportation or does something else. So that you will see, particularly like questions about BCI or RATBAC or the database checks will refer to employees in direct service positions. If there's something specific that is only for a DSP, it's going to say DSP. But for other people that may not be a direct service provider, then it's going to say employee in direct service position. specific to it, something specific to DSP is going to say DSP. This next one is about waiver nursing and LPNs. Instead of saying that LPNs are supervised by an RPN, an RN, it says that they are directed by an RN because the RN may not actually be their supervisor. They just change that terminology to the LPN being directed by an RN. This one is regarding epinephrine, and the change is because epinephrine is now available intranasally. So they changed it to include that it can be done with the auto-injector pen or intranasally. And then also the clarification that only if the person that the DSP is supporting needs that actual medication, the DSP is required to have the training. Everyone does not have to have the training, only if the person they're supporting needs that actual medication. And then this is the question I mentioned about a licensed facility, if their administrator is listed on the facility's records in PSM. So this has the guidance listed because there is a separate process for a facility administrator where they have to go through a different approval process and be than what a DOO has, but they have to be listed separately in PSM as the facility administrator. So they pulled that out separately from that first question about the DOO and have it now as a separate question for licensed facility administrators. And then this is a new question about direct support assistance, making sure that they don't provide intimate personal care, operate a vehicle, provide care forbidden by the individual, implement restrictive measures, or provide services to someone who doesn't consent to having services provided by the DSP, and always make sure that the DSP assistant is always in the company of an employee who's physically present where the DSP assistant's providing services and meets all background check and training requirements for DSPs. So this is a brand new question that if you employ DSP assistants, the reviewer is going to look for what the DSP is actually doing, make sure they're not doing any of these things, and that you have the correct setup so that the DSP is never alone with someone and that there's always an actual DSP present with that person. Okay. Vehicle modifications. I don't know that any of you all are vehicle mod providers, but these are the things that are required or in some of the questions for vehicle mod providers. I'm not going to go into detail on these. They're pretty straightforward. So those are the tool changes. Here is what we are looking at with the EVV question, which went into effect in December, I believe it was. Is the provider using EVV? These are the services that are required for EVV, and citations began this month if providers were not using EVV. We have two options that we can use to verify EVV. We have a report in Tableau, which is an EVV compliance summary report that we can look at And if a provider has EVV compliance higher than 0%, you are compliant. We go in there, we look, if we see, even if there are issues, even if you have things that, haven't gone through because things aren't matching up, but you have at least 1% that have gone through correctly, you're considered compliant. We can also look at your billed claims. And if you've been reimbursed for anything after October 1st, that is a service that requires EVV, you are considered compliant. So we have both of those ways that we can check to see that that you are compliant, and they're pretty easy ways for us to look those things up. So it's not a big deal for us to look at those. We have access to both of those things that we can check to see. Before I go into most common citations, are there some questions that people have? I haven't looked in the chat.
Yeah, Robin, we did have a question about the DSP assistant, and they were just unfamiliar with even what it was. So far I've explained that that's a 16 or 17-year-old employed by the agency. I don't know if you have any other
Yes.
info.
That's pretty much it. That's 16 or 17-year-old can be hired. They cannot do personal care. Let me go back to that slide. Whoops, I missed it. There we go. Can't do personal care. They can't transport anyone. If the person does not want the DSP assistant doing certain things with them, they cannot do those things. They can't do any restrictive measures. They cannot provide services to an individual who does not consent to having a DSP assistant working with them. They have to have another employee who is a DSP working with them. They have to meet the same requirements as a DSP. They have to have the same background checks, the same training, all of those things. But I would say anybody who has DSP assistants, I could see them being used to maybe do some of the more fun things with people, keeping them engaged and doing activities and, assisting when you're going into, into the community to do things. Having that extra someone who helps enrich someone's life, I think it would be a really good role for someone who's maybe just deciding if they want to make a career out of working with people with developmental disabilities. They can do some of those things that staff never seem to get around to having a chance to do, and really helping the person have a better life. So yeah, it's a good way to help introduce people to what we do in supporting people. And it's just there are very specific guidelines to what a direct support professional assistant is able to do. I would definitely make sure that you look at the rule about what DSPs are able to do. It's in the provider certification rule. And you need to make sure that you have those guidelines in place, and that they understand, and that your staff, your DSPs understand that they cannot ask DSP assistants to do certain things. So do we have other questions before I move on?
So the DSP, I'm sorry, I was kind of thinking the DSP assistants, I guess I'm kind of understand. I know that they cannot work alone. So I'm trying to see how it would make sense money wise, because that means you would have to have a regular DSP and then an assistant. So would they be good in like a 2-to-1? I guess I'm trying to figure out where you would place them. Because if we're doing community, they can't drastically, they can't take the person out themselves. They would still have to have another actual DSP employee with them.
True.
I'm gonna
I'm
chime in. I think this is typically seen in day programs.
Okay,
The
okay.
DSP assistant position, I'm typically seeing it in day services. Where you have
Okay, that makes a lot of
groups of
sense. Okay.
people and you have a DSP assistant that's like running activities while
Okay,
DSPs are doing the personal care and the medication administration and handling some of those other things. So like an extra set of hands in that environment.
got you. I appreciate that, ladies. I just wanted to make sure I understood where they would be appropriate in placing them at.
yeah.
Robin, someone asked, can a family member be an assistant? There's nothing in rule that says they couldn't.
Right. There's
Right?
nothing that says they can't. They would have to meet all the requirements of an employee. I mean, family members are hired all the time. So. Okay. All right. I'm going to move on to most common citations. All right, so what I did is I looked at the 6 counties that SWOCOG covers, which is Hamilton, Claremont, Butler, Warren, Montgomery, and Greene, and put together this list of most common citations. I'm starting with independent providers first because those tend to be a little different than what agencies deal with. So there are some that are common to both, but others that are not. So the most common citation for independent providers involves service documentation. Things like not having the required elements, Medicaid number, provider name, signature and initials, like any of those things on this list. We also see type of service not being on documentation, number of units, if you're doing a service that requires number of units, and then times the service started and stopped. We also see scope of service being an issue where description and details of the services delivered that directly relate to the services specified in the approved individual service plan are not on the documentation sheet. That's where you see your list of services and supports or risks or any of those services that are on someone's plan are not listed on the documentation sheet. We also see citations involving UI logs. Did the provider keep a log that contains the unusual incidents defined in the rule? And there's a list in the rule of what's required to be put on an unusual incident log, or an indication that there weren't any incidents that month. And is there evidence that the independent provider reviewed all unusual incidents as necessary, but no less than monthly? So some indication that that was reviewed. Then we have citations involving personal funds. So if that is a paid waiver service, helping someone with their personal funds, Did the independent provider make sure that account records included a ledger with all required elements and evidence of reconciliation at the frequency required, signed and dated by the person conducting the reconciliation? Then citations involving first aid and CPR certification, that's either their first aid and CPR is expired, or the provider did not do an in-person skills test, because that's required for first aid and CPR. So either of those. So here we are now with agency providers and the most common citations we see in our area. Once again, citations involving service documentation. Same thing that we saw with independent providers. It's pretty high up on the list. And again, the issue with scope of service. The things from the person's plan not being reflected on the documentation. But then things kind of go a different direction. We have personnel citations. We have employees conditionally employed for more than 60 days without the results of their BCI or FBI records checks. So you can employ someone up to 60 days in order to get their BCI or FBI checks back. But once that 60 days comes, if you don't have the results of those checks, you cannot continue to employ them. 60 days and then they cannot continue to be in your employ if you don't have their record, their BCI and FBI checks back. Required database checks done every 5 years for employees in direct service positions. So for employees that have worked for you for more than 5 years, they should have had their nurse aid registry check, abuser registry check, SAM database, the Medicaid exclusion list, Ohio and the national. All of those database checks have to be repeated every 5 years, unless you have enrolled that employee in ARCs. And then you still have to do the SAM database because for some reason it doesn't come through on ARCs. At least last I heard it hadn't been. Then you have to enroll all your employees in direct services positions have to be enrolled in RATBAC in a timely manner, which means within 14 days of receiving their BCI check. No, within 14 days, I don't have the rule right in front of me. It's within 14 days of hire. I can't remember. Anyway, you'll have to check the rule because my brain is not functioning this morning. And then training within 30 days of hire for each DSP in person-centered planning and provision of services, facilitating community participation and integration, provisions of the MUI rule relevant to DSP duties, including the review of health and welfare alerts issued by the department and empathy-based care. I did a special compliance review recently on an agency that was not aware that this 30-day training, which is different than initial training for staff. They were not aware this 30-day training existed, this requirement existed. So, and then this is continuing with personnel citations, attestations, the attestations that are signed prior to employment. So that was an issue. DOO's not getting their training. their annual training, and then issues with initial database checks being done prior to employment. I know I have questions on this. I saw things pop up in chat. I'm pretty sure.
Really just someone was asking if they get a copy of this, and I said we would be sending that out
Okay.
today.
All right, just making sure.
Nothing else in the chat, but maybe somebody
Okay.
else.
All right, just making sure because I saw things pop up. So, all right. Okay. That's what I've got. There is my contact information. Like Kathy said, I work for the Southwestern Ohio Council of Governments. We support 6 county boards in Southwestern Ohio to do things that are more reasonable for us to do than for the county to do. We exist to help the counties save money. So we do compliance reviews for Butler County. So that's why Kathy asked me to present this because I know a little bit about compliance. I've been doing compliance reviews for 15 years. Did them as an employee at Butler County and then retired and went to work for SWCOG and have been there almost 10 years now. So if you have questions about compliance, you're welcome to ask me. If I have the rule in front of me, I'm much better at telling you what the requirements are than recalling them off the top of my head, but feel free to ask me questions and I'll do my best to answer them. So let me stop.
All right, I don't know if anyone has anything now. Otherwise, I will include her information in our meeting minutes. That's very generous of you to offer that. We love rule. I love digging into them. Not everyone does, so feel free to utilize her if that would be helpful for you. And things change all the time, so it's hard to keep up on everything. So thank you so much for coming, keeping us up to date on everything. You know, it's very likely we'll have another tool change coming up here, April. They tend to do them in April or July and then November. So, you know, all of what we said may be totally more stuff again here in just a couple months, but we will keep you updated if that happens. Any other question for either one of us today before we hop off? Okay, you guys are a quiet bunch today. We appreciate you coming. It's always good to see you. Those of you that we can see, we appreciate you coming, and we'll see you again in March at our next meeting. Someone here just posted a question about Amy. So right now we are, Amy will not be replaced. She is irreplaceable, I think. So they can't fill it. So it'll just be me for a while, at least. So especially kind of see what happens with this levy, you know, so encourage you to look for the information about the PAC in our meeting minutes today. All right, great to see you all. I'm gonna go ahead and end our meeting and we'll be in touch. Have a great week, everyone.